Turning the page on myeloma, or multiple myeloma specifically, MM for short. We're learning more about this type of bone marrow cancer, in particular with World Cancer Day coming up in the month of February, for example, and with more understanding about how it's affecting individuals and what new treatment options we have, getting the latest insight from Dr. Kevin Tay, who's a senior consultant medical oncologist at OncoCare Cancer Centre. You see, the theme for the upcoming World Cancer Day has to do with closing the care gaps. And I want to know whether there are care gaps when it comes to myeloma that need to be closed and how we can do that. Hi, Dr. Tay. Welcome back to the show.
Hello. Hi.
Let's talk
having me on.
Let's talk multiple myeloma, this form of bone marrow cancer. What is it and how prevalent is it in Singapore?
So multiple myeloma is it's a type of white blood cell cancer rising to the plasma cells you mentioned earlier. It is only I think about 100 to 120 new patients are diagnosed in Singapore with multiple myeloma, and that's actually the second most common type of blood-related cancers in adults.
Okay, but still, second most common, but still some people would say those sound like rather small numbers. Why do we need to pay so much attention to this?
I think, no, it is, if you talk about 120, relatively small numbers, but patients are living longer with multiple myeloma. Therefore, accumulatively, we're having a lot more patients who survive for longer periods, and therefore they're surviving with their cancers.
And we want to make sure that they have good quality of life during that period.
So it again varies, but most of them do. If they are in remission, they have very good quality of life.
So how does somebody develop multiple myeloma, Doc?
There is actually no clear cause as how myeloma develops, but there are certain risk factors that may be associated with multiple myeloma. It usually occurs in older age group, above the 55, 60 years old patients. You have a higher risk of developing multiple myeloma. Typically, again, the male gender, there's an increased predisposition to multiple myeloma. And if there are patients who have a personal history of a condition called monoclonal gammopathy of undetermined significance, for MGUS for short, MGUS, or if they have known to have this abnormal plasma cells that is just in one bone location, what we call solitary plasmacytoma of the bone, they again carry a higher risk of developing multiple myeloma in the long run. Or if you have a family history, for example, of multiple myeloma, and then that, especially the first degree relatives, that again predispose you to a higher risk.
So those are the groups of individuals that may be at a more high risk, or the potential risk factors there. But again, a lot of these things are things that maybe I can't control. My age, my ethnicity, my family history, whether or not I have that MGUS or not. So how does this often get picked up? I wonder. How does somebody know that they've got multiple myeloma? Yeah,
so oftentimes it's picked up either from incidentally on the blood test. They may present with, because this is a bone marrow cancer, so it may present with sort of reduced levels of red blood cells, or even reduced levels of platelet counts. The bone marrow produces three main blood types. One is the red blood cells, white blood cells, and platelets. So you may see a reduction in your blood test if you go for your normal screening. Sometimes there are other clues. If you have elevated or worsening kidney function, because multiple myeloma produces this sort of abnormal proteins, which sometimes can affect the kidney function, resulting in an elevation of your creatinine levels, which is a measurement of our kidney function on a screening blood test. That can sometimes pick up. It can also be associated with higher levels of calcium levels in the blood, and that's another clue or indication that we have. Patients can also develop symptoms related to multiple myeloma, because it's a bone marrow kind of cancer. You may have bone pain, persistent bone pain of a certain area. Obviously, over time, there is a risk of developing fractures, even bone fractures.
Gosh.
So these are some clues if you want to pick up myeloma early, usually it's picked up incidentally on blood tests, and then go for further investigation, and then it results in the diagnosis being made.
Incidental blood tests, that can be such a shock, surprise to someone. They're going in for one thing, and then, by the way, we've detected that you possibly have this.
Right. I forgot to mention, actually, because in the blood test, one of the things I mentioned earlier is that myeloma, they produce these abnormal proteins. So again, from the blood test, if you see very high levels of proteins, and then in particular, there is a type of proteins that we normally do in a blood test called globulins, and that's high, again, one has to suspect if this individual has underlying multiple myeloma or not.
Now, here's the thing. We've heard about the characterization of myeloma as presenting in terms of a recurring pattern of relapse. There's relapse, and it goes away, then relapse, and it comes away. There's no cure for this either. Why is this the case with myeloma?
Yeah, unfortunately, multiple myeloma is not considered curable at this point in time because it goes through a series of genetic mutations over time. And the current treatment actually doesn't completely eradicate it fully. But thankfully, it brings it down to a really low level where, patients, the majority of patients do have very a good prognosis and long lifespan. So it's now what we consider even more like a chronic illness or chronic disease. Yes, I mean, in the last 2 decades or so, we have newer treatment options that have allowed us to better treat patients, and that translates into a longer survival.
How do we know when relapse has occurred? Because like you said, I mean, the initial finding might be through an incidental blood test. Are you feeling symptoms and signs? How do you know that relapse has happened? Are you under constant close monitoring?
Correct. So most of these patients will be on long-term follow-up, and by that we will be doing regular blood tests. And then the earliest clue is usually they are asymptomatic, they have no symptoms, and it's picked up usually on abnormal blood results, as I mentioned earlier. The blood counts, the abnormal kidney function, the high levels of proteins in the blood test. These are clues that we then suspect that the recurrence might have happened. Obviously, we will do routine full body scans as well. If let's say the patients do develop any symptoms, the bone pain, bone ache, we would then do the scans to identify the areas of recurrence.
Coming up, I want to know more about that. We're going to talk about how a patient who's experiencing recurrence or relapse is treated and managed. Dr. Kevin Tay is here, Senior Consultant Medical Oncologist out of OncoCare Cancer Centre. I'll be back on Health Matters. Stay tuned. So as we've discovered in the first part of today's discussion, multiple myeloma is known to affect maybe 100 to 180 persons a year, new diagnoses in Singapore each year, around those numbers. We don't exactly know what causes myeloma, but our doctor guest has walked us through many of the known risk factors associated with it. In line with the upcoming World Cancer Day on the 4th of February, where the theme is about closing the care gap in cancer care. Let's talk about whether there are any gaps in myeloma that need to be closed. Dr. Kevin Tay is here, Senior Consultant, Medical Oncologist out of OncoCare Cancer Centre. Doc, let's talk a little bit about that relapse situation. That's where we left off. When a relapse does happen, does that patient have to go through very similar to treatment to what they went through before, or is it very different?
Yeah, so myeloma, the treatment for myeloma has really evolved for the last 2 decades. I mean, we no longer even rely on the conventional chemotherapy that you know about, the ones that cause hair loss and things like that. Right now, when we talk about treatment for multiple myeloma, it involves targeted therapy. Targeted therapy means it could be an oral medication, a simple injection, but this is a lot easier to administer compared to 20 years ago. And that's because of advances in medical research in the last 20 years with better understanding of the biology of myeloma. We now have developed targeted treatments against some of these abnormal genetic abnormalities or molecular pathways that we know drive the cancer growth. Yeah.
how do they respond? What is the prognosis? What's the scenario like with each relapse?
Right. So patients, like I said, they go through multiple relapses, but they have very long survival rates, and the relapse treatment are different. I mean, we use different medications, and it has really improved over time. What are some of these examples I was talking about? Like, we have targeted therapies. We now even have monoclonal antibodies that targets the cancer cells, and even immunotherapy. And that really has changed the landscape of treatment, resulting in patients having longer lifespan.
Can we talk more about that? I mean, how much of a game changer has this been for multiple myeloma in particular? What was it like 5-10 years ago?
Right. So even going back 20 years ago, I mean, we're talking about a median survival about 3 to 4 years. But now the median survival rates we're talking about is approaching even a decade. And it's in time we expect it to be even longer with all these newer treatments that are available for our patients.
What are we talking about in terms of whether or not they can avail themselves of such treatments? Because of the nature of these newer generations of medications, I'm curious, does it mean only a sub-portion of these 100 to 180 of patients every year that are diagnosed are suitable for it?
Yeah, that's a very good question. I mean, obviously, with all these newer treatments, the cost of these treatments are also higher. But thankfully, a lot of these treatments are actually available in all the hospitals in Singapore. Even the newer treatments are available, and patients are not denied treatment even with these newer medications. They're covered by our integrated shield plans. And also in the government hospitals, these are also covered by the MediSafe and MediShield coverage.
These individuals also might tend to be older individuals, above 55. That's one of the risk factors, right? Do they have to meet certain physical conditions? Does the multiple myeloma have to be of a certain type before they can avail themselves of new treatments?
No. As long as they have these relapses and if they are in line with the indications, these are all will be covered by and they will be able to be received the adequate treatment and appropriate treatment.
So coming up, how do these actually work? More on that in a moment. Stay tuned. So, Doc, with the new generations of treatments that are available, you mentioned things like, targeted therapies, monoclonal antibodies, immunomodulatory agents. CAR T-cell therapy has come on in the last couple of years. I hosted a whole seminar on this once and the power of it. It's interesting that we tend to see a lot of these new generations perform better with some of these blood cancers or bone marrow type cancers. We tend to see the better results coming from these types of cancers for these treatments, don't we? But they could be applied to other cancers in the future, I would imagine.
Yes, I believe it will be extended to many more cancer types, not just in the blood-related cancers. But, intuitively speaking, I mean, it's always starts off with the blood cancers because these are all immune-mediated cancers, and therefore the immunotherapies tend to work a lot better in the blood-related cancers. But there are also other cancer types that are also that are more amenable to immunotherapy that will come into play in the coming years as well.
How would something like, what is the most exciting one right now, would you say, for something like myeloma? Would it be the CAR T-cell therapy? Would it be the immunotherapy?
I think the immunotherapy like CAR T cells and even the bispecific antibody therapies, the immunotherapies, these are the game changers I foresee in the coming years. And these, when they come into mainstream, when they come into mainstream in the next couple of years, we'll see a lot more benefits derived from this treatment. And our patients will definitely live longer because we are already seeing that in the clinical trials, and it's very exciting to see patients living longer. For some of these cancer patients who have many relapses and very little treatment options, and you see this happening, it's very exciting.
That window of opportunity that was never there before.
Exactly.
In many cases. Actually, speaking of, let's end on that note, Doc, which is the idea of these relapses. I'm sure somebody who's experiencing it or who knows somebody who has multiple myeloma wants to find out whether or not there's a chance to prevent that or delay that relapse in some way.
Right. I mean, there are actually no proven preventative strategies for multiple myeloma, but there's no harm in keeping a very healthy lifestyle, a well-balanced lifestyle, incorporating good eating habits, having regular physical activities and adequate sleep. These are just basic common things that one can do. Even minimizing stresses in life. I mean, I think these are important, and also keeping a positive attitude and outlook is also vital, in my opinion, in keeping cancer at bay.
Doc, thank you so much for joining me today and for helping our listeners understand some of the latest when it comes to the advancements we're seeing in treatment options for multiple myeloma. And maybe these can help close some of those gaps that I talked about in terms of myeloma care. Dr. Kevin Tay, a senior consultant medical oncologist out of OncoCare Cancer Centre. And this has been Health Matters. I'm Daniel Martin. Thank you all for joining me on today's edition.